Well, hello and welcome. You're watching India Fights Back with the host Rajat Kain. In this episode, we'll discuss the Delta variant and its role in spreading the pandemic. Of late, it's been the Delta variant that has been a cause of concern in several countries of the spike that we are seeing in the numbers of COVID positive infection across the world. Largely, this phenomenon is due to the Delta variant. Well, Delta variant, it's noted for its severity and spread. It was largely the Delta variant that was responsible for a devastating, catastrophic second wave of the COVID-19 pandemic earlier this year in the months of March, April, and May, where several people lost their lives and faced acute oxygen crunch. Now, how, therefore, it is important to understand the variant in general and also to envisage what is there in place for future if we do not take corrective measures at this stage. To discuss further on this issue, we join with Dr. Ravi Godse. He is internal medicine specialist from Western Pennsylvania Hospital. Many thanks, Dr. Godse, for joining us, and Dr. N.K. Ganguly, former Director General, Indian Council of Medical Research, ICMR. Let me start with you, Dr. Godse. Sir, what is the extent of Delta variant spread across the world as we speak? I know I have a couple of stats in front of me. As per WHO, 135 countries have reported Delta variant among the COVID positive cases.
I think it's asking someone on Titanic as what other problems do you have apart from iceberg. Now the question is moot. It's all Delta. B1617.2. 99% of the British cases are Delta.
Right.
More than 93% of cases are in US are Delta. Delta, as you know, is B1617.2,
Yes.
which the Indian media lovingly likes to call the Indian variant, or New York Times called first discovered in India. But it's all Delta now. Everything is in. And I just wanted to take a quick, not objection, but a quick pointer to your initial opening statement.
Sure.
You were saying that Delta is more infectious, obviously, but you were also saying it's more dangerous. We don't know that for sure.
Okay.
If previously one person was dying out of 1,000, now if you are seeing 10,000 cases, you are going to see 10 people dying. That doesn't mean 10 times people are dying. Just the number of cases is high. So everything is Delta now. US, everything is Delta. We just don't even ask. If you can smell it, it's probably carbon monoxide. So we are assuming everything is Delta. Yeah.
Well, I rather, sir, let me just put things in perspective. I mentioned that Delta variant is notorious, or to say it's known for its severity and spread. Well, so talking further on the severity and spread, I mean, what mutations are we seeing? Are we seeing some more mutations in the Delta variant as well?
Are you asking me?
Yes, sir. Yes, sir. Please carry on, sir.
I don't think so. Means I have, like, if you look at my Twitter handle at Dr. Godse Ravi1, I've been sending some interesting tweets.
Right.
And I had tweeted out saying that I think Delta Plus is nonsense.
Okay.
Means Delta Plus could exist, but to claim that, you know, in some remote part of India, they are able to, means we are not able to provide oxygen cylinders. That in some remote lab, they are going to find that the patient had COVID, then figure out by genetic analysis that they had Delta Plus, and then figure out the status of their vaccination. And I just don't buy it.
Okay.
So the more we wait talking about these future variants which will cause trouble, in fact, Delta variant's greed might be its undoing. We can talk about it later because it is so infectious. It may exhaust itself very quickly.
Right. Mr. Ganguly, sir, I mean, talking of, say, India at large, as we are seeing, say, daily numbers around 40,000 odd, I know the second wave is not over yet. So, what are the measures in place first to check the severity and spread of Delta? And as we further talk about, the hypothesis of third wave, do we see Delta variant once again becoming, the talking point whenever we see another spike? If at all we see another spike, nobody wants to see another spike, of course.
Actually, Delta variant is one of the variants which has been able to establish itself, and
Mm-hmm.
as you have rightly said, move around the world. About 135 countries around the world have this, and they have it in a very big way. But
Mm-hmm.
in India, the recent Delhi data shows 80% of all is Delta variant. And so this is the major variant which is in circulation. And some of the states in India, particularly Kerala, comes out very high in this
Mm-hmm.
list, is having a very large outbreak of this infection. Our health infrastructure has improved. There is no paucity of oxygen now, and the treatment management methods have improved. So the survival is much better everywhere than other. But hospitalization has increased in the areas where it is, and also in the US, in the state of Florida and Texas, hospitalizations have increased.
Mm-hmm.
One particular trend in hospitalization is worrying, but that the children's hospitals are also getting full, and that particular trend was not seen in the earlier variant, like either UK variant or Brazilian variant
Right.
or the South African variant. So the children are now getting affected, and although the death rate in children is very low, but they are
Mm-hmm.
getting affected. So that's an area of concern. Luckily, children vaccination is there, but
Mm-hmm.
since they will be going to school, some now the children's vaccination with the with the vaccines available have been allowed. So we will have to vaccinate the teachers, and we will have to vaccinate the children. Of course, masking etc. will have to be done. The other major thing which we are seeing with the Delta variant
Mm-hmm.
is this, that this is a pandemic with those who are unvaccinated.
Mm-hmm.
In India, we have vaccinated the largest number around the world. More than 500 millions have been vaccinated in India.
Right.
However, even then there is a very large number of unvaccinated people. So the danger will remain that it will be spreading. And if one part of the country has it, other part it will come because of the hazard ratio. What we know, the Keralites and others move around the world, and in India,
Mm-hmm.
this will be spreading. One more point I want to emphasize, that it has now been seen that not only those who are vaccinated should wear masks, because one doesn't know that who is vaccinated, who is not vaccinated, but we now know that if you are vaccinated, you may get a breakthrough infection. You will not die. You will not be hospitalized. About 99% of them will have a milder infection, but they
Okay.
will also be able to spread. Previously, we didn't know that whether they are able to spread or not, but now we know that they are also able to spread the infection to other.
Mm-hmm.
So this movement around the world and others, we have to be a little bit more, because there are a lot of vaccine passports and other things which are being now given. We need to be alert. At this given moment, through mathematical modeling in India,
Mm-hmm.
we expect that we might have another surge around November. So
Okay.
this is what at the moment an Indian scenario reads.
Right, right. Many thanks, Dr. Ganguly, for putting your points across. Just stay on, sir. Dr. Ganguly, let me ask you here, sir. The worldwide we are seeing this phenomenon of spread of the variant, and as you said that we have, like, India have vaccinated more than 500 million people. At the same time, sir, I mean, there have been instances of vaccine breakthrough as well. How serious is the vaccine breakthrough or breakthrough infection?
The vaccine breakthrough infection is reality.
Mm-hmm.
The best vaccines, that is both Pfizer and Moderna, they have now followed it up to 6 months. The
Okay.
Pfizer has been followed it more than 6 months. These studies have been given to US FDA for a decision making, and then it wanes in 6 months. This is what the
Mm-hmm.
Pfizer and other study says,
Right.
and they are the Moderna is only up
Can
to six
I
months.
interrupt?
Pfizer
No,
study,
one second.
it
Yeah,
has
yeah.
it has
I'll come back to
reported,
you,
and the data
Dr.
has
Godse. I'll
been
come to you. I'll come
submitted
to you,
to
sir. Yeah, yeah.
The
Yeah, please,
data
please
has
carry
been
on, Dr.
submitted
Ganguly.
to US FDA for consideration. Some of
Right.
the European countries, as well as Israel and others, have started giving booster to two groups.
Right.
One, those who are vulnerable, that immunosuppressed, though like transplant patients, cancer patients, and others, and also above 60. They have already started giving. USA they have not given. They are still studying the data and studying
Right.
that whether it is happening or
Right.
not.
Right.
These studies are on at this given to see whether this waning is happening or not. There are several studies which are going, but the study which has been submitted to the regulators is a company generated data, and so we may agree or we may disagree. But what Dr. Fauci recently commented on that there is a follow-up of more than 6 months available with Pfizer's data, so they are studying it, and the Moderna is only up to 6 months. But main point which is coming up over here, that at this given moment, the booster is not an option for most countries, not
Right.
definitely not our country, definitely not African countries and other countries where there is
Certainly.
a vaccine paucity.
Right.
So we cannot afford to give that, but we may have to keep in mind that we will have to remain alert.
Right. Right. Thanks, Mr. Ganguly. I'll just come back to you. Yes, Dr. Godse, you were saying something. Please, sir, carry on.
There is absolutely no data that shows that the Pfizer immunity is waning. All these studies are being done in labs and the antibody testing. As a internist who have seen hundreds of these patients, I think not only reporting these studies is pointless, doing these studies is pointless. These vaccines could not be studied in the lab. They have to be studied in real life. There was a big study that came about Pfizer antibody neutralization, saying that Pfizer was 6 times less effective against Delta. What happened in real life? Against normal COVID, it was 92% effective. Against Delta, it is 88% effective. In real life, as Dr. Ganguly obviously knows, there is T cell immunity, there are other methods. The antibodies level do not always predict how the effectiveness is going to be.
Okay.
So has not been absolutely any data about Pfizer's antibody being waning. That fake Lancet study printed by Indian media on their front pages was not even a Lancet study. It was a letter that somebody had sent to Lancet. So in real life, even the Chinese vaccine, Sinovac, it worked really well in Chile in real life. It kept the hospitalizations down by 85%. In US, we are not talking about boosters. I'm not talking about any conspiracy. But nobody's talking about boosters. If immunocompromised people get a shot, that will be a third shot in their primary series. Nobody is calling it a booster. We are not worried about that for a year or so. Vaccines work against variant. People are talking about a fully vaccinated can still get COVID. There's a 12, he or she himself will not get sick. And we keep talking breathlessly about that person being able to give it to someone else. That's why he or she should wear a mask. But nobody's talking about whether a fully vaccinated person can give that infection to another fully vaccinated person. The recommendation from CDC is only a guidance. It is only in the areas where there is high COVID transmission. There is nothing in Pennsylvania. The United states that have more than 50 to 60% vaccination, we are not seeing anything. Only problem is Florida, Alabama, Arkansas,
Okay.
Texas, where the vaccination rate is 40-45%. And let me ask one quick philosophical question to end this, to end this topic. If Delta is so bad, if Delta is so infectious, if Delta spreads like wildfire, why are the Indian cases sitting at 40,000 for past 3 weeks? Does it make any sense? Why these 40,000 cases are not exploding into 4 lakhs? Why are they sitting at 40,000? That means the people surrounding the infected people are already protected. There's not going to be
Okay.
any third wave in India. The natural immunity is the best. There is not going to be a third wave. Even to talk about it, I don't think it. And I have very strong opinion on that. There's not going to be a third wave.
Right. Just stay on, Dr. Godse. Mr. Ganguly would like to respond to it. No third wave. That's what Dr. Godse says. And also, like in terms of numbers of cases that we have seen in last 2 to 3 weeks, they're plateaued around 40,000, and they're not exploding as quote unquote Dr. Godse said. If Delta variant is so strong, what possibly explains this phenomenon?
Now, in one way, Mr. Godse is right, but in other way, it is different because our sero surveys show that around 68% of us have antibodies. This is a surrogate marker that these people have been exposed to infection. So very large number of Indians have got exposed to infection. However, the sero survey is not very truly representative of the migrant workers as well as very rural areas and peri-urban areas. Mostly it is the urban areas, some small sampling is there. But it is true that very large number of Indians have got now the antibodies. And it will only say, I will not say that they're immune or what, but I will only say that they have been exposed to infection. So at this given moment, the numbers in India have not exploded to that much. But now when we are opening up very strongly and very large number, much more larger percentage than US, although the number wise we have vaccinated more people, but many more people than US are unvaccinated in India. And when we are opening up, those particularly those who are poor and those who are earning their living in various crowded situations, they are not able to follow all the COVID protocols which are in place, because many of them can't do it. And so there is a possibility. So it depends on us. If we will have 3 or 4 more vaccines in another month. The Johnson & Johnson vaccine can be given to, it has already been cleared and it will be distributed by BioE. It is a one-shot vaccine, so we will be able to vaccinate more and more people. And if we are able to follow the other COVID protocols for next 3 months, we might be stopping it. But at the moment we go by how it is spreading from nearby states to other states, and it is spreading, and the number is not a comfortable number. If you have got 20 to 40,000 sometimes cases coming up, and hospitalization has not decreased, hospitalization is a very good indicator.
Right.
Deaths are not increasing. Death, of course, I explained that why it's happening. It is in our hands, whether we want a third wave or we don't want a third wave. So one of the things which is happening in the system, and I want to be very clear about that whatever vaccine, whether it is a very effective vaccine or it is a moderately effective vaccine, it protects. It protects you from severe infection. It protects you from dying. And majority of the infections are in the unvaccinated people. So I want to assure everyone that whatever discussion we have, we should never go away from that vaccine is working. But main issue is that we need to, if we are opening up schools and all the protocols which are needed for that, we need to follow. Wherever we are creating crowded situation problem, whether it is a religious function or is a sports function or whatever it is, we need to be careful. At least next 3 months, we need to be super careful. We will then prevent it. Otherwise, we may expect a catastrophe as it is happening in the rest of the world. In Europe, several countries, even Israel, which has immunized, this strain has spread around the world. But there is no denying the fact. Nobody can say that this has not spread around the world. And it has stayed. It has staying power more than other strains. Many of the other strains have petered out. But this particular thing has stayed for a pretty longish time period globally.
Right. Dr. Godse, just before we end the show, sir, We have often seen a trend here in India and the states which have a rapid urbanization and higher mobility of public. We have seen the rise in number of cases, and especially in the Delta variant. Are we seeing a similar global phenomenon, and that obviously would be a driver in terms of decision of opening up economies and opening up of life in general?
No, I think India has reached that threshold of herd immunity. I think we are ready. The natural disease protects you the best. I will reiterate. We were talking about. I just sent a tweet at Dr. Godse Ravi one. US had doses, India had cases, and United Kingdom had doses and cases. What happened to United Kingdom? Why is nobody not talking about United Kingdom? United Kingdom opened everything up, though the world was telling them
Right.
not to open. They were told not to give the mask mandate. The masks are given up in UK, totally optional. You look at Wembley Stadium, you look at the soccer. The world media was salivating to go after UK after that, saying that what is happening in UK? There are no cases in UK. The Delta has made a quick hairpin turn. As I said before, Delta is so infectious that it has infected everybody that it could infect. India's mortality rate is the best in the world, maybe because of previous common cold viruses. Enough Indians have already had COVID. We are at the level of the herd immunity. If government wants to do something, there's a small study out of Kentucky that shows even people who have had COVID should take vaccine. That helps them. Vaccines work. They prevent serious disease. Do something different. If you see a crowded place and people going to vacation in Manali, don't keep showing it on TV, shaming the people. Send a vaccination van there. If you're doing zero surveillance, consider giving vaccine to people who are seronegative first, so you increase the herd. Moderna was approved in India on 15 July. How many doses are given in past 4 weeks? Nothing. Johnson and Johnson, it took 6 months to approve. Work fast. If there is a hotspot, send a vaccine there. Don't distribute vaccines alphabetically. Don't send it to Arunachal Pradesh and Assam first because they start with A. If the cases are in Kerala and Maharashtra, send the doses there. Find cases, send doses. Think the thinking. Get the bureaucracy out of it. India is already out of this. India has reached herd immunity. There's not going to be a third wave, but keep wearing masks. If you don't want to wear masks for the rest of your life, wear them for next 2 months.
Right. Many thanks, Dr. Godse. Mr. Ganguly, just this last a question to you. I'm sure, like as Dr. Godse pointed out, it's not that simple that we're distributing vaccines or other vaccinations are sent to states based on the alphabetical order. But certainly, just taking forward a cue from what more perhaps can be done in terms of vaccination here in India, sir.
Actually, vaccine situation in India, what we need to do, that sometimes suddenly one of the vaccines runs out. So we need to look at the distribution chain as well as the inventories very carefully and reach vaccines in places where it is needed most. I will agree with Dr. Godse in this particular thing, and see that vaccines are available. Also see that vaccines are not inadvertently given another vaccine to person who has been given. We need to train vaccinator again very well, particularly in the rural areas, because that has happened once and it should not happen. The third thing where we need more data, that when we are running out of one vaccine and we have another vaccine available, or some ladies who cannot take one vaccine and has to be given another choice, we should be able to do it scientifically with a good data set in this. Finally, if we are having more than one vaccine, some will claim that it is working better than the other, and there will be some kind of discord which will be happening. Somebody will say, I want Pfizer, somebody will say, I want Moderna, or I want Johnson Johnson since it is single shot. That particular thing we need to propagate, that all vaccines are working. So at this given, you may not have a choice, but in future you may have a choice. My final word will be, as Dr. Godse has said, I have repeatedly said this, that next 2 to 3 months, please be vigilant.
Right.
Don't reduce your vigilant and take care. In India, there is a big disparity. There are a huge amount of poor, migrant and distant populations. Look after them. There are nobody who they themselves cannot look after themselves. So look after
Right.
them, have good communication. They should have good knowledge. They should not have fear, and they should get what is the best for them.
Right. Many thanks, Mr. N.K. Ganguly, former Director General, ICMR. And many thanks, Dr. Ravi Godse, Internal Medicine Specialist, Western Pennsylvania Hospital, for joining us and elucidating on this extremely important aspect of the Delta variant and how we have to read the spread of the COVID. Also, the corrective measures, and of course, vaccination, along with the COVID appropriate behavior. Well, that's it in this edition of India Fights Back. Thank you. Goodbye.